Dr. Burton Feinerman. Dr. Feinerman is a physician who practices in anti-aging and regenerative medicine. He specializes in stem cells and gene therapies. He will be speaking today on the positive results from stem cell therapy changing serious health conditions. Ladies and gentlemen, Dr. Feinerman.
So thank you very much for coming, Dr. Feinerman. You're really in the midst of someone who's been in the medical field for many, many years. He was actually a pediatrician for 50 years, but then he decided there was something very big out there that he wanted to partake in. And he's on the cutting edge of stem cells, and he'll tell you some stories that'll really blow your mind of how he's helping people. So thank you for coming, Dr. Feinerman.
Welcome to Future Medicine. Stem cells and gene therapies can actually challenge the incurable. I've only been in medical practice, as Anita pointed out, 62 years. And it's in the last 15 years that I've devoted myself fully to the research and treatments for stem cells. And yet it's so amazing to me with that being said, that the United States is so far behind the rest of the world. I mean, some of the stem cell treatments that I'm telling you about have been widely used throughout Europe, certainly just about every country in South America, where actually I got my initial experience and training in Peru, and even in Japan, Philippines, Thailand, and probably the leading country of the whole world when it comes to new medical technologies is Singapore. But still, there's still resistance. I mean, stem cells should be part of everyday medicine. I don't think I'm going to be around when that will occur, and there's so many things, be it the FDA, insurance companies. Someone was just talking about the cost of stem cell treatments, which certainly is a consideration. I know myself when I go to have any medical care, I take my Medicare and my ARP insurance, and everything's paid 100%. But still, when you're faced with a threatening, life-challenging disease, be it ALS, Parkinson, Alzheimer's, and progressive multiple sclerosis, you have to find some way, and there are ways where people can raise money through friends, relatives, community services, churches, or even websites like GoFundMe. And there's also a whole bunch of finance companies that are available that will help finance 100% of the cost of a stem cell treatment. The other day, and I'm 87 years old now, and so I noticed that my kidney function was beginning to decline a little bit, just a little bit, but it concerned me. So I went to the nephrologist, and he says, well, it's no big deal. It's okay for your age. For my age? I don't want it to be okay for my age. I want it to be okay for a 40-year-old. And so I'm in a different position than you are, but many of you could do the same things that I did. Here's a case where the treatment for treating end-stage kidney disease or chronic kidney disease or early kidney disease is a situation where you can't just simply give the stem cells intravenously. They won't get to the kidneys. And so I have a facility in the Miramed Hospital in Cancun, Mexico. So I go down there, I get my stem cells taken from my own body. It can either be taken from my abdominal fat or my bone marrow, and it's introduced directly into my kidney safely and easily with an interventional radiologist. He simply takes a sterile catheter, inserts it in a blood vessel, a superficial blood vessel in the upper thigh, and then under direct fluoroscopy, and there's a giant screen in front of you, and you're wide awake for this because it's painless. You see the catheter being passed right up to the right and then to the left kidney, and then all the mesenchymal stem cells are introduced that way, and in less than 90 days, the kidney function that you may have, even if it's down to 10% of normal, will go up to 50% of normal, and in my case, it went up to 100% of normal. The same thing is true with the diabetic. If we try to give the stem cells intravenously, which would be kind of nice, they won't get to the pancreas. They actually end up in the lung. That's, I can tell you a little bit more about that. If you have lung disease, which is, I hope you don't, but if you do, it's so easy to treat and cure COPD, pulmonary fibrosis, and emphysema. And so again, the interventional radiologist passes the catheter up to the pancreas, puts the pancreatic islet stem cells right in the pancreas, and voila, within a short time, your A1C and your blood sugars are normal. Goodbye insulin pumps. People that have to live on 5 or 6 shots of insulin every day or have an insulin pump, it's it certainly affects your lifestyle. The same thing goes with a whole host of other diseases.
I'm going to interrupt you because I want you to tell the story of the athlete. A lot of athletes are doing this. And you had a wonderful story about a baseball player.
Well,
You have so many stories.
yeah, I got a lot of stuff.
I know.
Line, and he injures a joint or an Achilles tendon or a rotator cuff in the shoulder, and he's going to be out for half or the entire season. And I think to myself, I sure wish I had this guy's telephone number. Because within just 2 weeks or so, that person could be out on the field as far as athletes are concerned. I think Anita's referring to a patient that actually lives right here in Sunny Isles Boulevard, Sunny Isles up in North Miami Beach, right across from the Trump Tower. and this fellow was a catcher in professional baseball for about 12 years, and he was the only person, I think, in baseball history that hit 4 home runs and a double in a single game. And here he was lying in a bed, curled up like almost in a fetal position, no speech, unable to feed himself, incontinent, and very aggressive. And he had severe dementia. We treated him with mesenchymal stem cells that differentiate into neural cells. And these neural stem cells with 5 different brain nerve growth factors were given to him. And they were administered by lumbar spinal tap, which can be done painlessly. And the first month, his wife called me up often. He's not any better. And the second month, she said, he's not any better. And finally, thank God, in the third month, he sat up for the first time. He stood up. He started walking around the house. He got on the phone and started talking to friends and members of the family. And then later in the day, sat down and watched TV, watching Hillary and Donald Trump. And So amazing things can happen. But what if that fellow had just, just followed what saw the neurologist? The neurologist would say, well, I've done everything I can. This is the way it is. Well, let's just try to make them comfortable. The same thing is true with a whole bunch of other things. People with blindness, the most common cause of blindness is macular degeneration. And an amazing high percentage of us in the 80s, 70s and 80s get macular degeneration, sometimes even younger age groups. And living in a world of blindness at any age is certainly a terrible thing. And I have a center in Lima, Peru, where I work with a retina doctor, and we're able to introduce retina pigmented epithelial cells and neural stem cells, completely reactivate the photoreceptors, the rods and cones, and that person has a decent amount of vision that is returned. The same thing goes with retinitis pigmentosa, which is a genetic disease, or Stargardt's disease, which is also a genetic disease that causes blindness in children. It's actually, they get early macular degeneration, all of which is treatable and curable. Ever since the human genome was discovered, not so many years ago, we've been able to attack conditions which I, as a young doctor, worked hard and endlessly, never to have any success. And now a condition like cystic fibrosis, I had when I was a young doctor, 25 years of age, they actually set up a laboratory for me to do research in cystic fibrosis when I was 25. And but we did most of those kids died when they were about 6 or 7 years of age. As a result of some of the work that was done, we were able to extend the length of life to like 20 years of age. But still, but those last few years, they had a rough time with cystic fibrosis. Now you can successfully treat cystic fibrosis. You knock out the abnormal gene mutation, and you insert the normal gene. You give them stem cells, and you've given a person a new life. The same thing is true with people with Huntington's disease. And to some degree, we've had success with children with Tay-Sachs. And, but you know, it was actually Dr. Anita Finley who made me think about something, and I've tried to introduce it into medicine, but I think it'll take 50 years before it'll ever get accepted. And that's the idea of using stem cells for healthy people. In other words, you're 50 years old, so you go to the doctor's office, instead of the usual blood pressure and EKG and blood test, the doctor gives you heart stem cells. And you come back next year and he says, well, it's time for your brain stem cells, etc. And so this concept, I'm sure will work, but it's changing the way doctors think is very difficult. 95% of doctors don't know a damn thing about stem cells. And yet they often are an obstacle when the patient goes and says, well, I went to this doctor and he says that he's going to treat my osteoarthritis with stem cells. And the doctor will say, oh, that's just experimental. That's not going to work. And speaking about that, it's the orthopedic doctors that are the only ones that have entered into the field of stem cell in quite a large percentage of cases.
So, because I don't want to run out of time before you get to ask a few questions, but my discussion with you is, okay, you've told us this, what can we do as a society to help you to get this out more? I know that you've been on our radio show, you've been writing articles, but what you talk about is almost a miracle, and you're right, there's a lot of negativity out there, so what should we do?
Well, I think the patients are in revolution of that, because they go to the doctor who diagnoses them with COPD, the patients, he tells the patient that they've got 6 months to live. The patient's on oxygen 24 hours a day, 2 to 5 liters, and go home. Yeah. But come back and see me in 3 months. Come back again and see me in 3 months. But what are you going to do? The patients have their own little private revolution, and thanks to the internet and search engine optimization, patients do discover us. And so, and most of it, I mean, I can count on my fingers of my one hand in 15 years the number of doctors that have referred a patient to me. So I think that it's important in places like this and on the internet to get the word out. Stem cells are not new. I did a stem cell treatment on a child who did have an immune system. He was a child in the bubble, and he's now, he was 8 months of age. He was being treated at the University of Miami with gamma globulin shots, and the kid was slowly dying. And we treated him with, we gave him a stem cell treatment almost 50 years ago. And he's now teaching high school in South Miami. So the idea that it's new is not the case. I gotta make sure, because I know my friend Bill has been interested in this subject, and that is
Sex?
and that is the subject of ED, erectile dysfunction.
Please go do this.
And it's with all the things I'm telling you about, you know, all these serious and depressing and heart-breaking diseases that people have faced. Being deprived of normal sexual function, especially men, they take their Cialis and their Viagra, they go through that period in their 50s or so, or 60s, then that just stops work. Only a small percentage then migrate over to an ED clinic where they learn to give themselves an injection of a mixture of prostaglandins, but syringe and inject into the penis, which just isn't very romantic. And so that's a big one, you know. Some people want to buy out my inventions, and that's the one thing I want to save. Oh, I want to sell that one to Pfizer.
Well, I think what we have to do now, only because we do have this, what we've done is we've tried to bring you as many speakers in one day. So it takes a little bit of pushing, so we give 25 minutes for a speech and then 5 minutes for a Q&A, and then it will never be enough time. So what we ask is the doctor goes out into the hall, and if you want to talk, go talk to them. Dr. Feineman has a card, and I totally approve of him. I have to tell you that this is very serious stuff. These are not quacks that we bring, even though some of it sounds almost impossible. He has a fantastic reputation around the world. We're lucky to have him. He has an office in Wellington. So now, I think we ought to, we're going to have some questions. We need to have the mics on here.
Yeah, there were a couple of people that raised hands before.
Yeah, there's a man that, yeah, he's going to come. He's going to talk to you.
I don't think I need the microphone.
No, you don't. You're pretty good.
Okay, good. Thank you. Well, it's a pleasure to meet you, Dr. Feinerman. And, you know, for 38 years, and I want to just point something out to give you some empowerment to keep doing what you're doing. Because it happened to me. I finished under Dr. O'Neill Humphreys, Johns Hopkins Cardiology, as an internist medical doctor. 38 years later today, 37 years later today, I became very, very versed in alternative, complementary medicine, and as it progresses through the years from 38 years ago. Because when I got done, I said, I know everything there is to take care of a patient as a resident in internal medicine under Dr. O'Neill Humphreys, Johns Hopkins Cardiology. He was the chief of cardiology for 14 years at the finest heart hospital in the world at that time, and he left Johns Hopkins to go to Columbia, South Carolina, where my teachers in medical school said, you don't have to match, you're coming with us to Columbia, South Carolina. Anyway, I wasn't excited about it, but it was the best move I ever made. So through my 3 years of residency, internal medicine, I knew how to treat everybody. And I would start seeing my patients, and I bought a practice that had been in existence for 25 years, and I was busy from day one. Hooray, hooray, hooray. I was best friends with one of your colleagues that I will mention his name, and you will say, absolutely, I love the guy. So
Who is that?
Dr. Neubauer, Richard Neubauer.
Oh, I knew that. Yes, I knew
Yeah,
Dr. Neubauer.
I am just recently appointed the CEO of the Neubauer Hyperbaric Neurology Center for Advancement Anti-Aging. Very, very exciting.
Fabulous. Well,
So let me just finish, and I'll be as brief as possible.
Okay.
What I did was when I would have a patient come in and they said, well, I'm getting this treatment, and I said, what do you mean? I don't know that treatment. I would take my time. If I had a patient who was under my primary care, I want to know everything they were doing, all the treatments they were getting, and I would investigate it. And through the years, I am now a member of the A4M, American Academy of Anti-Aging Medicine. And through the years, I learned a lot. I've kept up. I know about you. I know what you're doing. And here's what I have to say. It is a struggle. When you're doing things that are not accepted, in general, it's a struggle. Just keep up the work. And every time you get a positive, make sure you report it. Bring it out. The doctors who that patient was from America, went to you in Cancun, they come back, they're good. That doctor's going to make a note of that. This is how we will foist it forward. Anyway,
you know,
thank you.
that's really wonderful. We never had a doctor in the audience, this is strange, to come here and do this. What is your name?
I'm Paul Presti.
Okay, so
You have a question, Jody?
Thank you.
Just here in Boca Raton.
Fabulous.
I have a question, and I'm not going to be talking about myself this morning, but I'm going to ask, can you give us a little more information on what you've been doing specifically with pulmonary fibrosis? Have you had a lot of patients? Have you had a lot of success? Is it complete success? Is it partial success? Can you give us some feedback on that particular ailment, please?
About 4 years ago, a group of some wealthy investors approached me and wanted to buy up my patents in lung disease, COPD, pulmonary fibrosis, and emphysema. I'm speaking about pulmonary fibrosis. I was the first person who wrote an article in the medical literature on pulmonary fibrosis in the 1950s when I didn't need Viagra. They were very generous to me, and I had to set up 5 clinics from the East Coast to the West Coast, which I did. I was supervised directly or indirectly over 3,000 patients with lung disease, of which a good 1/3 of them were pulmonary fibrosis. And the treatment was amazingly successful. We kept careful records. We reported these results. People that were on oxygen got off oxygen. People that were had low pulmonary function, we recorded the improvement that way. The treatment involved isolating mesenchymal stem cells from their adipose tissue or bone marrow. And as I mentioned earlier, 100% of those stem cells go to the lungs, where they can repair the damaged areas in the lungs as well as regenerate. But in addition to that, I added a few special things like anti-fibrosis growth factor and anti-translational factor, which had an important aspect in their getting well. So the success rate was over 80%, even with pulmonary fibrosis.
And I hate to do this, our next guests are here, but I will suggest that you do this. Now, Dr. Feinerman has had a whole seminar on stem cells. Maybe we have to think about doing that again with you. Maybe we'll talk about that. It's a hot subject, and you know, we don't have any more time because we're going to take it away from our next. That's what I'm saying. I'm so sorry that we have to keep this rolling. He will go outside, though. He likes to listen too, but go outside, take his card. He has free consultations. He's a genius. He's a wonderful man. We're so privileged to have him here for you. So why don't you do that?
I just want to, in your particular field, I've also worked with patients with addiction, people with depression, and autistic patients as well.
Okay, so we're going to just thank you.
As you can see, you're in for a very interesting day. It's extraordinary power of the speakers that we have.